So today we're answering a user question from Sierra, who asked if a spinal tap and a spinal fusion are the same thing. So to answer your question, Sierra, they're actually two completely different things. In a spinal tap, you use a small needle to place inside the spinal canal, inside the dura, which is a covering of the spinal cord, to drain out some spinal fluid. And you might do this for two reasons. One is to obtain a diagnosis based on what you see in the spinal fluid. Some diseases, for example, in Guillain-Barré syndrome, have very characteristic makeup of the spinal fluid. There you see what's called an albuminocytological dissociation, which means the amount of protein compared to the amount of white blood cells is dramatically different. And that helps you with the diagnosis, particularly in diseases where your own body may be damaging your nerves. In other diseases, such as subarachnoid hemorrhage, where there's bleeding in the brain from an aneurysm, you'll see a very high content of certain cells, for example, red cells, that will clue you in that this may be going on. Spinal taps are typically done as an outpatient. You generally will get a diagnosis either right away, or sometimes they'll have to send it to a lab to get an answer. But typically speaking, they don't invasively do anything to the vertebrae themselves. By contrast, in a spinal fusion, you're fusing two levels of the spine together. This classically is done by placing bone graft and what's called decortication, which means you trim off the outer layer of the facet joints or the joints of the spine to allow a fusion or allow a healing of bone along these joints. This could be done using screws and rods. It could be done using cages as well. You typically do a spinal fusion for one of two reasons. One is that you have abnormal movement or instability between segments of the vertebrae. This could cause pain. This could also be done as a result of a fracture or a tumor that may have damaged some of the elements of the spinal canal that's causing abnormal movement and could be causing a risk for spinal cord injury to the nerves or injury to the vertebrae themselves. Spinal fusions typically are done in the hospital. They may be done as an outpatient, but classically they will require an inpatient stay. And this actually would involve real surgery where you have to go in, open up the joint, and perform the surgery. So hopefully that answers the question. As always, if you have further questions, use the hashtag AskDrJ.